Hey friends, it's Susan from legslikemine.com, and today I wanted to talk with you a little bit about the questions that you should ask or think about asking your doctor when you go in for your lipedema diagnosis. So, obviously, assuming that you know you're walking in and you're asking for a lipedema diagnosis, you probably at this point already know what lipedema is and know that there's actually no cure for it. But a couple of really important questions you can ask your doctor are based on this information that I'm bringing you, right? Like the standard of care or some piece of information so that you're sure your doctor's educated, is what type of lipedema do I have and what stage of lipedema do I have? And it really doesn't actually make a difference, but it sure is nice to know that your doctor looked at your entire body and they're like, okay, you've got it in your arms, you've got it in your hips, your abdomen, your thighs, your lower calves, right? And they, based on the guidance that's in the standard of care, they can tell you, you're a type 1, 2, 3, 4, you're stage 1, 2, 3, 4. And especially when you get into those later stages, the threes and the fours, like me, you need to absolutely understand that whether or not you have lymphedema as well, lipolymphedema is what it's called, because there's treatments that you need to be doing to manage the lymphedema part of the later stages of the condition. So the typing and the staging are two things that your doctor can really help you with. Even if they weren't familiar with lipedema in the past, they can have the clinical guidance in front of them and be like, oh yeah, I see that you've got it in these several different areas. Just a tip, if you go into a surgeon who claims to be somebody that's experienced with treating lipedema, or they say, hey, I can treat your lipedema, a couple of questions that you might want to consider asking them is, how many people with lipedema have you treated already? One, have you had any really bad outcomes where you've had a patient die or anything like that, right? And then the third question, which I bet you stump most of the doctors on, is what is your program for follow-up care? How long do you see a patient after they're surgically treated? And what is the long-term outcome for your patients? How long does the reduction stay? And I bet you most of the doctors who treat your lipedema will be like, oh no, we treat you, we do like 2 weeks of follow-up care, we send you on your way, and then we never see you again. But if you are lucky and you find a doctor who's like, oh yeah, I've treated, hundreds of women with this condition, and by the way, we have a continuity of care program where we make sure that you've got, wherever you are, right, that you have a team of people that are integrated that will support you from now until for the rest of your life with things like manual lymphatic drainage, therapy, if there's any supplements you need to take and stuff like that. So look for those kinds of centers of excellence type places that are looking to more than make a quick buck off of you and just get surgery, but they want to actually treat you from pre-surgery work, which yes, there's work to be done pre-surgery as well, right? Like you need to come in as uninflamed as possible so that you get the best outcomes, all the way to how do I manage this condition once I've had surgery to remove it? Or if I decide not to have surgery, how do I manage this condition? And I absolutely believe that there is a lot more to managing lipedema than just that one surgical treatment and bam, you're done. So if you can find a doctor who answers those questions in the way I just described, definitely comment below, because there are many, many women who are looking for that continuity of care over the lifespan. But I don't think you're going to find one, to tell you the truth. Anyway, what stage, what type, and if you're going for treatment, how many have you treated, and what are the long-term outcomes, and have you ever had anybody pass away from the surgery? Hope this helps somebody. What do you think? And be sure, if you haven't been following me for a while, check me out on legslikemine.com. I have all kinds, years of content now about lipedema-friendly outfits, information on just the disease and managing the condition. And then also this channel here, be sure and like and subscribe, because I have so much content, including my surgical recoveries and all kinds of things that I've been through as I did my own continuity of care. Right now, and the way it's been with most of us, is that we have to do our own continuity of care, learning from each other on the internet. So if I can share with you anything that might give you a golden nugget of information to help yourself, take advantage of it, man, because it's free information and it's here for you. So, anyway, I'd like to hear what you think. Be sure and like and subscribe, and I'll talk to you later. Bye.